Good evening. I am very much thankful to Sitaram Jaipuria Foundation for kind invitation for this program. I was really thrilled to listen today to the eminent speaker. Actually, myself and my wife, Dr. Kavita, we are providing free medical services to the tribal area of Mayaghat, which is situated in the northeast part of Maharashtra, around 900 km from Delhi. It is difficult to access hilly forest tribal area. Moving. Thank you. So Mahatma Gandhi said, real India lives in villages and youth should go village to serve. That was the key source of inspiration. My grandfather, Mr. Vasantrao Ambedkar, Dr. Prakash Amte and Abhay Bang, they inspired me to start this work. Because of lack of proper health facilities and superstitions, the tribal goes to traditional faith healers, where skin is burnt with red hot iron rod known as damma, and it leads to very high mortality of children, adults, and maternal mortality and malnutrition. We started our program. That was our first hospital in the beginning, first intensive care unit, and the first home where Kavita is cooking food on chulas, and next were our regular visitors. We are conducting around 11 community-based programs, 5 hospital departments, and we are also working at policy interventions and public-private partnership. In the beginning, as patients were not coming to hospitals, so myself and Kavita, we visited around 450 tribal villages of Maharashtra and Madhya Pradesh and treated more than 260,000 patients in the village itself. In our new hospital, we have treated more than 140,000 patients, mostly free of cost, and conducted more than 5,000 surgeries. Ours is the only hospital for treatment of critical care. We have treated more than 5,400 patients with case fatality rate of only 8.8%, which is significantly less as compared to average case fatality rate of around 18% of India. During COVID also, the case fatality rate was around 16.9%, which is less than 30% case fatality rate of Indian ICUs. So the mortality rate is proportional to the corresponding severity of disease. Not moving again. Yeah. So under the blindness control program, Kavita and her team, they screened more than 5,70,000 patients. As most of the patients, they were not coming to hospitals. Many times they had to go with the ambulance through the river to reach the people. They used to screen the people, and they found that childhood blindness is a major issue. So they screened more than around 1,15,000 patients from more than 300 schools. And they have prevented blindness of more than 36,000 people through surgeries and treatment. Most of the treatment are free of cost for poor tribal. We have full-fledged maternal child hospital. We have arranged more than 331 specialty camps for treatment of more than 23,000 patients. Reshma was an orphan child with severe malnutrition, cleft lip and cleft palate with hemoglobin of just 5 grams. She was operated by Dr. Gahankari and his team in our hospital, and later on she was put on local therapeutic food, and she is Reshma after 3 months and Reshma today. 3 years before, Dr. Abhishek and team operated a huge goiter of around 2 kg, 20 centimeter large, third largest goiter surgery in the world, and she is living now normal life. We realized that just sitting in the hospital is not enough. To solve the problems, we have to move to the community, so arrange community meetings from planning to execution phase. And we started our first cluster randomized control trial called Home-Based Child Care Program to reduce child mortality through trained tribal, local, semi-literate married women called village health worker in 34 villages. They managed around 1,05,000 illness episodes in the village, provided home-based newborn care, intensive behavior change communication program. That was our first training center under the mango tree. They conducted various audiovisual programs. The village health worker gave injections to more than 3,000 newborns without complications, treated neonatal sepsis, provided kangaroo mother care to low birth weight babies, even birth weight up to 1,000 grams in the village itself. And because of this RCT, we could demonstrate that under 5 mortality rate, infant mortality rate, neonatal mortality rate, and perinatal mortality rate reduced significantly in intervention arm as compared to control arm. The difference of rate ratio of IMR and under 5 mortality rate was significant. The prevalence of severe malnutrition reduced significantly in intervention arm as compared to control arm. We conducted another trial called community-based management of severe malnutrition, which was interventional prospective control community-based trial. It was implemented through the same village health worker who provided local therapeutic food to around 1,885 severely malnourished children and treated associated infections, and intensive behavior change communication was given. Nutrition demonstration program was conducted, hand washing demonstration was done. Lakshmi was severely malnourished. She was on the verge of death. Parents refused hospitalization because of poverty. She was treated by Mirabai, a 7th standard pass village health worker who treated Lakshmi with injectable antibiotics for pneumonia and sepsis. And later on, she was put on local therapeutic food, and she is Lakshmi today. And the recovery rate of severe acute malnutrition in our trial is as equivalent to international SPEAR standard, while the case fatality rate and default rate is significantly less in our trial as compared to international trials. The prevalence of severe acute malnutrition in our area is now less than the rest of India as per NFHS 5. The recovery rate of severe underweight is around 51%, one of the highest in the world. We replicated this trial with Government of India in 20 another villages, where the prevalence in the control arm, there was no change in prevalence of severe malnutrition, while in intervention arm, the prevalence of severe malnutrition reduced significantly. The case fatality rate of severe acute malnutrition is just 0.3%, which is significantly less as compared to rest of the trials, and we achieved the WHO target of CFR of less than 4%. Age-specific mortality rate of 16 to 16 years is very high in tribal area of India, which is 2.3 times as compared to rest of India. So we conducted another cluster randomized control trial where our village health worker treated cases of hypertension, diarrhea, malaria, pneumonia, provided referral to the cases, and conducted intensive behavior change communication program, provided local therapeutic food to the pregnant woman. And because of this trial, we could significantly reduce the age-specific mortality rate from more than 500 to less than 227 in the intervention arm, while in the control arm, there was no significant change, and the difference was statistically significant, again shown in replication phase. We conducted one public-private partnership called Counselor Program for strengthening of 14 government hospitals, which benefited around 770,000 patients. It improved hospital delivery rate from 2% to 70%, hospitalization of severely malnourished children from 0.1% to 14%, and there was statistically significant improvement in the recovery rate of hospitalized severely malnourished children in intervention arm. During COVID, we provided 24/7 services. More than 173 critical COVID patients were treated. Out of them, 100 were treated with ventilators or NIV, who came with SpO2 of 50 to 60%, and the case fatality rate was less. We realized that personal touch and speech of senior doctor is very important. To make it sustainable, we developed more than 12,000 nutrition gardens and farms, which prevented malnutrition of more than 4,000 families. We are also running mobile medical unit. We have started de-addiction program, as alcohol is one of the major killer, and socio-economic upliftment activities which has benefited more than 15,000 families. As we realize that this is not the only problem of Melghat, it is problem of all tribal areas of India. So through dissemination of our research, advocacy, and public interest litigation in High Court as well as in Supreme Court of India, we could modify around 49 state-level policy of Maharashtra and 2 national policies, which has benefited more than 10 lakh tribals of India and more than 1 lakh severely malnourished children. So we could significantly reduce malnutrition and mortality. Our research has been published in around 45 international journals and in 44 international conferences. WHO has given Public Health Champion Award, and World Economic Forum has given COVID Achievers Award. Harvard, USA, and UNICEF has mentioned in Lancet Global Health that these initiatives are hugely successful and influential for community-based care globally. It has tremendous efficacy and staying power. Evaluation by 4 medical colleges of India and University of Colorado Denver has mentioned that these interventions has definitely reduced various mortality indicators and malnutrition. These are sustainable and effective interventions, safe, affordable, acceptable, approachable, and achievable with local manpower. These are replicable, and it is generalizable also to achieve SDG and WHO goals for tribal area of India. Rajmata Jijau mission, the highest mission of government of Maharashtra, has mentioned that the highly active Mahan has disseminated the true figure high burden of the disease. Their advocacy has resulted into creation of Rajmata Jijau mission itself, and it has increased demand on the ground for public services amongst the marginalized population. And the strongest tools has the data showing the high burden and solution to reverse the damage. Because I am very much thankful to Sitaram Jaipuria Foundation for awarding me into 2022. Because of the money given by Jaipuria Foundation, we could purchase a land and which will be used for building a nursing college, which will improve the general health of the society. It will generate the employment, as task shifting is very important in tribal health care. We are also planning to build Tribal Health Research Center of Excellence. It has increased our reputation. It has increased our visibility, which is allowing us to get more funding. And the most important thing which I like of this foundation is very transparent process of selecting the awardees with the help of very high esteemed juries of India, most of the super specialist doctors from the most renowned medical colleges of India, which has increased confidence of myself and others, and it will have very long-term impact. I am very much thankful to all of you again for your kind attention.